I was born in Cambodia during the Khmer Rouge Pol Pot. We walked 52 days from Cambodia to Vietnam. This is the first picture that we left Cambodia to Vietnam. 1984, we were asked to move from the city to a refugee camp. Back in a refugee camp, we worked very hard. Life was very tough, but everyone, I think that we all work together. But our hope is pretty much the same. One day, we hope that we can go to different country. When we come to the U.S., we come here basically with few clothes, and we start our life all over. We don't have money and rely on our uncle to, provide us a daily life. We were so happy and relieved that we are in America. It's freedom. We will start our new life and start to work what we want and what we wish for. And it was difficult to learn not only the life in America, but the language was a challenge. The system in America is so much different. Not only the system that we need to make an appointment, the language barrier, but the insurance part was the most challenge, especially for myself and my parents, and especially for anyone who have a language barrier or as a new immigrant. We are very appreciative to ICHS that it provides basically inclusive services. Not only that, a lot of caring and professional providers at ICHS has, and they also provide the language, the interpreter. I remember a lot of time I talk to my mom. She's always saying that she like not only to see the provider, the staff member, the provider, the interpreter are very caring. I took my mom to see the doctor at ID Clinic one day, and when I stepped in, I feel like something make that passion that I really like about seeing the team work together, and they work like a family. The provider, especially, she has been seeing the same provider for so long, since the year that we came to US, and it was back to 1992. And this is where I started most of the time looking for a job opening. And I started at Holly Park. The experience felt like I was able to contribute to help other patients who probably have the same difficulty, have the same questions as a new immigrant. Again, I am so honored, humbled to say that I got so many opportunities to work from Holly Park, and then to ID Clinic, and then now at the Bellevue Clinic. But every clinic I work with is like a family. And I think it's very important because ICHS provide affordable healthcare and low-income healthcare for our patients and to improve their wellness. I started with as a receptionist. What I like about reception, because I like to interact with patients. I like to hear their story, why they're here for, how can I help? And that was the most part that I remember, and I like so much. And I continue to see that a lot of time patient comes in, have all kind of questions. I want to listen and see, okay, this is the challenge, or this is the need that they want, and what can I do to provide them? Now being a health center manager, now I hear more. For example, if there's any issues from whether it's from a patient or suggestions or a team member, we always come up and say, okay, what else can we do, right? And that is the part that really motivate and wanting to do more for the clinic and the patients. Why is it important for ICHS to take care of patients? This is ICHS mission. We like to make sure we provide care for our patient and to stay healthier. What happens to our patient if there is no affordable service to our patient? Our patient will be more sick and unhealthy and worried just because that is not available for patient. So it's important for the donor who can support, whether it's $50 or $5,000, so that this patient will continue to receive affordable health care with the community support.